constituents that are having issues, or if you do have groups that you would like for us to come and explain the program to the different communities, we're more than happy to do that. We're not promoting one program over the other. We're promoting good health care for the citizens of Mississippi, in particular in this target group across the board, but particularly right now, so that they understand what this is and how it will benefit them and the state.
Thank you, Ms. True. At this time, we have Dr. Weisenberg from the American Academy of Pediatric Physicians. Dr. Weisenberg.
Thank you, Chairman Dito, Vice Chairman Johnson, and members of this committee for allowing us to come here today and let you know our concern from a physician point of view. We, as I said, I'm representing the Mississippi Chapter A&P. We have a large group of pediatricians across the state, along our professional group, and we have been collecting comments from them over the last couple of months since this program has started. I've distributed a fact sheet that most of you have, and I wanted to point out the bullet points, basically. I'll start at the bottom where it says medical home. Pediatricians, anyone who's involved with children, are going to want to give a child a medical home. And we want to give them our medical home, and we want them to buy into the concept and to come use us. And most pediatricians, I gather to say all pediatrician groups, are going to have answering services or some sort of after-hours care that they provide unique to their community. Of course, we have our family medicine doctors and our advanced practice nurses, and we have all sorts of situations, sites across the state in terms of rural health clinics and big group practices and little group practices. We have all that. But I'll start back at the top. Our issues have really not been our issues are impacting our quality of care, our efficiencies, our paperwork. And I want to point out that there's no consistent pharmacy drug list across the three companies, and four if you include CHIPS. We have Mississippi Medicaid, we have CHIPS, we have United Healthcare, we have Magnolia Centene. The patients that we take care of course, are spectrum from anywhere from a nice little sweet well baby with no problems to those with complex medical needs. The ones with complex medical needs are going to see multiple physicians. Multiple physicians are going to need to have their own specialty medications, and they'll start at the bottom and use generics when they can, and then they'll work up to the more specialty drugs. And we simply don't. We simply go to the second one where it says insufficient recognition of what they need. We need more choices in our medication formularies. I made that clear in my conversations with the different pharmacy benefit manager companies that we don't have enough choices. Like, for instance, a child who's 4 to 6 years old cannot take Concerta for ADHD. They need Focalin they can pull apart. Focalin's not on every PDL. So, and then there are drugs that are appropriate for adults that are not appropriate for children. So we simply need, I think, more uniformity and more broad width across the formularies. I think you all ought to get together and have the same thing, if you ask me. That's what I think. But we do need to have some farm drugs that little kids can use. We have many patients who have more than the 2 grand 5 total legislative limit that we've had for several years now. We need to be able to tell you every medicine they have, every disease they have, and we need to expect that it's given to us across the year so that we do 1 sheet of paper per year if we need to. And I would prefer not to, but if we need to, 1 sheet of paper per year is what we need. I will say that Division of Medicaid's regular Medicaid programs, I call it, have improved their process in the past year. And just since January 1, I've had much less paperwork involved with that program. Then there's denials for selected drugs. We have